I made this video to talk about acne, what it is, how you can treat it at home, and how doctors go about treating acne based on the clinical guidelines of Boston Children's Hospital. Acne is the most common skin condition, with over 80% of people having acne at some point in their lives. Acne can occur at any age, but it is most common during the teen and young adult years because it is caused in part by a rise in levels of androgens such as testosterone. Testosterone levels increase significantly in both males and females during early adolescence, peaking in your 20s, which results in more acne in that age group. Acne affects primarily the face, neck, chest, and back, because these areas have higher concentrations of androgen receptors in the skin. Although some people are not bothered by acne, it can have a significant impact on quality of life, with one study showing that the psychological and emotional problems caused by acne were as significant as those reported by patients with asthma, epilepsy, and diabetes. In order to understand why people get acne, it helps to understand skin anatomy. Our skin is composed of 3 layers: the epidermis, the dermis, and the hypodermis. With the exception of our palms and soles, our skin is covered by around 5 million hair follicles. Hair follicles start in the dermis and extend through the epidermis onto the surface of the skin. Each hair follicle has a sebaceous gland, which produces sebum, an oily substance that travels up the hair follicle to lubricate the skin. As mentioned earlier, the rise in androgenic hormones such as testosterone during adolescence causes an increase in sebum production. Sebum can mix with dead skin cells and clog up hair follicles. A clogged hair follicle with a buildup of sebum and dead skin cells results in what is called a closed comedone, which looks like a raised white papule or a whitehead. When clogged hair follicles are open and exposed to air, the sebum will oxidize and turn dark, resulting in a brown enlarged pore called an open comedone or a blackhead. High sebum levels also favor the growth of a bacteria called Propionibacterium acnes. When this bacteria mixes with sebum and dead skin cells in a clogged follicle, it leads to inflammation, resulting in a red inflamed papule called a pimple. When clogged hair follicles become severely inflamed, they can lead to the formation of cysts and nodules and may end up leaving scars. Many studies have looked at whether certain foods cause acne or can make acne worse, although some studies have found an association between fatty foods, dairy, chocolate, and carbonated soft drinks with acne. Other studies found no correlation. So our advice is, if a food seems to make your acne worse, perhaps you should avoid it. Otherwise, focus on eating a healthy, balanced diet. There are good over-the-counter treatments for acne that you can do on your own without needing to see a medical provider. Successful acne treatment depends on a multi-pronged approach, including skin hygiene, treatment with benzoyl peroxide, and treatment with an over-the-counter retinoid gel called adapalene. You should wash your skin twice a day with a skin cleanser that contains salicylic acid, such as Cetaphil Gentle Clear or Neutrogena Acne Wash. You should avoid touching your face and don't pick at your acne. And use only non-comedogenic creams and makeup. Avoid hard scrubbing that can lead to skin irritation. Benzoyl peroxide is keratolytic, meaning that it breaks down the outer layers of skin, opening up clogged pores, and also has antibacterial properties. Benzoyl peroxide is available in 2.5, 5, and 10% strength. You should start with 2.5 or 5% and work up as needed. Use benzoyl peroxide twice a day, but be careful. It can bleach clothing, towels, and bed sheets. You should treat the entire face or affected area, not just spot treatment. Retinoids include adapalene gel, also known as Differin, that is now available over the counter, and prescription creams such as tretinoin, known as Retin-A, and oral isotretinoin, which many still call Accutane, although that brand has not been available since 2009. Retinoids are vitamin A derivatives that act on receptors on skin cells, making dead skin cells less likely to clump together and block pores. Retinoids also have anti-inflammatory properties, decreasing the redness and inflammation that comes with acne. You should treat your whole face or affected area every evening. Adapalene, like other retinoids, may increase the sensitivity of the skin to sun and lead to sunburn. Always apply it in the evening and then wash the affected areas with soap and water before sun exposure. Acne treatment causes a decrease in sebum production, which often results in dry, flaky skin. If you are getting excessive drying, you should use your treatment every 2 to 3 days, then increase the frequency as tolerated. And you can also use a facial moisturizer such as CeraVe Facial Moisturizing Lotion, Cetaphil Facial Hydrating Lotion, or Neutrogena Hydro Boost. For mild acne, doctors often prescribe a treatment with a combination of medications, including a topical antibiotic such as 1% clindamycin, a topical retinoid such as 0.025% tretinoin cream to use in the evening. Tretinoin works by opening up clogged follicles, so you should cover the entire area with tretinoin, not just spot apply it, to prevent acne from forming. Tretinoin, like other retinoids, may increase the sensitivity of the skin to the sun and lead to sunburn. Always apply it in the evening and then wash the affected areas with soap and water before sun exposure. The use of sunscreen is always a good idea. In addition to the prescribed antibiotic and retinoid, you should continue using a facial cleanser that contains salicylic acid such as Cetaphil Gentle Clear or Neutrogena Acne Wash twice per day. And you can continue to use benzoyl peroxide in the morning. Don't use it in the evening at the same time as the retinoid cream, as the combination of benzoyl peroxide and retinoids at the same time can make the treatment less effective. You should also avoid using a cleanser with salicylic acid at the same time as your retinoid cream, as this will also break down the retinoid cream, making it less effective. To avoid excessive skin drying, your doctor will likely start with a lower strength of tretinoin cream, and at a follow-up appointment, if tolerating it well, may increase the strength of the cream. You may also start using the tretinoid cream every 2 to 3 evenings and gradually increase the frequency to every evening. There are a number of prescription medications that combine 2 products in one. However, these will likely have a higher copay or may not be covered by your medical insurance plan. The most common reason acne treatment does not work is noncompliance. People stop using the recommended treatment because they either forget or it was causing skin dryness and irritation. If you forget, you can download a free medication reminder app such as MediSafe or MyTherapy. If your skin is getting dry or flaky, use the tretinoin less often and use a facial moisturizer as mentioned earlier. You should use the prescribed treatment regularly and follow up with your doctor in 2 to 3 months to make sure your acne is improving and to adjust the treatment as necessary. For moderately severe acne or mild acne that is not improving with the treatment mentioned above, your medical provider will likely increase the strength of the tretinoin cream and may prescribe an oral antibiotic such as doxycycline, tetracycline, or minocycline. If you're female, your doctor may recommend going on oral contraceptive pills to treat your acne. Oral contraceptive pills with both estrogen and progesterone help with acne as they decrease androgen levels, one of the factors discussed earlier which contributes to acne formation. For severe acne that has not responded to the previously discussed treatment, your medical provider may prescribe a combination of 10% benzoyl peroxide, high-strength tretinoin, and an oral antibiotic twice per day. Your doctor may also prescribe spironolactone, a prescription blood pressure medication that lowers your body's production of androgen hormones, or oral isotretinoin, a very effective acne treatment. However, it can cause significant side effects and birth defects if taken while pregnant. Talk to your doctor if you feel that this is the right treatment for you. I hope you found this video helpful, but if your acne is not being well managed, you should schedule an appointment to see your medical provider for evaluation and treatment.